Hey, I'm Dr. Brad Watts for Biogenetix, a doctor of chiropractic and an expert in functional medicine and clinical nutrition. Like we talked about in a previous video, the next 10 years are the golden years of natural healthcare if you can do a few things really well. One of those things is digging in on your patient's lifestyle, being able to leverage their daily choices into health and healing. In order to do that, you have to know who you are serving. And so in a natural healthcare clinic, did you know that you can divide your patient base up into 4 specific types of people, 4 specific conditions that you're seeing, and 4 root causes to those conditions. So grab a piece of paper, write this down. Quadrant number 1, patients that are dealing with degenerative and arthritic conditions. These are the people you're serving in a chiropractic setting. These are the people that are coming back to you over and over and over for the same condition. Essentially, you're treating them for the human condition, which is gradual destruction of joint tissue. It's autoimmune related, or if it's trauma related or overuse related, it could be DJD, it could be RA, it could be degenerative changes in their knees, their ankles, their hips. What's really cool though is that in 2019, it doesn't really need to be a life-altering situation. Between mechanical care and a chemical component added to it, you have the capacity to promote proper function in these patients. Quadrant number 2 are patients that are dealing with neurogenic pain. These are your patients with neuropathies. These are your patients with metabolic disease like diabetes. These are your patients that have numbness and tingling that's not due to a normal stimulus. Sciatica, peripheral arterial disease, localized inflammation, and even endotoxin reactions creating pain in somebody. These are super common conditions in a natural healthcare setting because the only answer in modern medicine right now is opioids, and we all know where that's headed. Quadrant number 3 is serving patients that are dealing with systemic inflammation and or metabolic disease. These are your patients with obesity, diabetes, gut problems, chronic fatigue syndrome. These patients usually cannot detoxify their physiology. And for most of them, supporting healthy detox pathways is an absolute life-changing event. Quadrant number 4 is focus and cognitive decline. These patients range from adolescents in school to high-powered CEOs, teachers, physicians, lawyers, anybody from an athlete to your Uncle Joe. You see, cognitive decline right now is the number 1 healthcare crisis that is going to bankrupt, absolutely bankrupt, the baby boomer generation. The problem is it's a silent killer. It's not something that people like to talk about. They try to hide it. These patients try to maneuver through society so they're not found out. And again, in 2019, it's not something to be embarrassed about. What I'm talking about is solutions. Solutions that are plug and play. Solutions that allow your patients to take steps in the right direction. Like, we gotta let that innate intelligence back out. Let it out of the box. Stop letting it be chained up in the basement. Give it some building blocks to work with, for crying out loud, so that these patients can heal. You know as well as I do that the body was designed for health and healing. It was designed for vitality. It was designed to express vibrant health. So grab your pen once again. Quadrant number 1, these patients are being paired with the Biogenetix Regenerative Support Kit. Quadrant number 2, these patients are being paired with the Biogenetix Pain Kit. Quadrant number 3, these patients are getting linked up with the Biogenetix Metabolic Clearing Kit. In quadrant number 4, these patients are linking up with the Biogenetix Brain Box. There are phenomenal educational resources for you designed around each of these kits. Who the patients are, how to help connect them, and how to move them in the right direction. The best part is that it's plug and play. There's nothing for you to do. For more information on how to identify the types of patients you're serving and the specific kits involved, follow the links below. For Biogenetix, I'm Dr. Brad Watts, a doctor of chiropractic and an expert in functional medicine and clinical nutrition.